And today we're tackling a topic that affects every woman, but just isn't talked enough. We're talking perimenopause. Now, joining us is my girl, Dr. Terri-Ann Samuels. She's a board-certified urogynecologist, and she's actually the host of the Menopause podcast. Yeah, thank you for joining us today.
Thank you so much for having me.
I love you. I love how much work and heart you put into educating women about perimenopause and menopause. So let's start right there. What the heck is perimenopause? Because I never heard of it.
It's a fairly new topic for a lot of us because we know the word menopause, kind of like we know the word puberty.
Yeah.
And we're coming to grips. Menopause is a very hard diagnosis, and it's very textbook as 1 year without a period. And now we're recognizing all the other effects. And then when you start recognizing the other effects of menopause, you recognize that they started happening much earlier. So to our now clear understanding is that we're talking about 8 to 10 years before your period stops, on average. So it is upon most of us. But the key is we want to take the word menopause and perimenopause and we want to put a positive light on it. Just as generationally we started to put a positive light on puberty. It's not something to be ashamed of. It is part of your growth. We're happy to be alive to be able to go through it. We want to make menopause an amazing transition for women and recognize the symptoms, be aware of them, and help them through this transition into the best part of their life.
And is this why you started the menopause?
This is why we started the menopause. The easiest thing is to see other women where you are, right? If I see you, if I see that you have symptoms that I have, one, I don't feel alone, and one, I know, and two, I know that there's something we can do about it. And so on purpose, because one thing with these women in their 40s and 50s is that we are busier than we've ever been.
Yeah.
And so therefore, we don't have time to listen to, you know, half an hour. An hour per podcast. So each episode is usually no longer than 20 minutes. And the idea is that you don't have to listen to it front to back. Find your symptoms. Find the woman who's talking about the things that you are going through. And that makes it much more relatable, less time consuming, and knowing that you're not alone, you can get help.
You know what? I think every episode relates to me. So let's talk a little bit about those struggles, because perimenopause, as you mentioned, you know, it's 8 to 10 years before menopause even hits, and we're always thinking like, oh, night sweats and hot flashes. But there's more to it than that. It's more of a gradual rise into that stage of life. Right.
I think with time and research and awareness, we've become we understand that transition. Part of our superpower as women is having that estrogen. And when it starts to wax in ways, it has an effect on us. And again, as we go through that transition, the first thing that we noticed in the medical community is that a lot of conditions started to get worse. And so when you backtrack and say, okay, well, how can we make this better? We understand that that deficiency is something we all go through, and so we recognize the symptomatology. And so things like, we used to talk strictly about very objective symptoms that everyone went through, right? Your hot flashes and night sweats. But a hot flash never killed anybody, right?
No,
right?
That's true,
well, so what it essentially is, it's a siren. It's saying, woo, woo, we're shutting down, right? Something's happening.
The factory's
Something's happening, right? And so, and that's okay, right? But it's welcoming in that transition. What I want people to recognize are the symptoms that truly affect your quality of life beyond hot flashes and night sweats.
Let's talk about those symptoms, because those titles on some of your episodes, they get me.
Yeah,
like
good.
The poop one?
Yes.
Like, yeah.
The poop is everything. You want to be able to poop well, right? That's, you know, it should be your daily joy.
Yeah.
But like joint pain, hot flashes, obviously we talked about hot flashes, night sweats, brain fog. We talk about...
Brain fog. You always blame it on being a mom, right? I'm a busy mom, so I've got to have brain fog.
No, well, you blame it on being a mom. It's our first exposure to brain fog for many of us is pregnancy brain, right? If you remember those days. And it does almost come back, but that's hormonally related, right?
Yeah.
So it's just this kind of feeling, I'm just not quite there. I walk into a room and I'm like, why did I come in here, right? But...
Story of my life.
Right. But you know, for some people, that's not a big issue, right? But if you're a litigation attorney and you got to turn it on in the courtroom, these are things that can really affect your productivity and your confidence. So those are things. So when we talk to patients in our practice, we talk about prioritizing those symptoms and attacking the things that affect you the most. And so brain fog being one of them that can be severe. Sexual dysfunction, especially due to dryness, libido, joint pain, which is a nice new one, the occasional palpitation, drier skin, and I mean the list goes on and on.
It really does.
And some people purport that we're talking about over 70 symptoms that are due to menopause.
Okay, so if you're feeling like kind of just not yourself, get in touch with Dr. Terri-Ann Samuels. Here's her website, Urogenius website, Houston Gynecology.
HoustonUrogynecology.com.
That's right.
Got everything you need.
Yeah, get in touch with her. She'll let you know what's what, if you're in perimenopause or heading towards menopause, or if you just needed someone to fun talk to.
We have a good time.
She's a great hang, y'all. All right, thank you so much, Dr.
Thank you for
Samuels.
having me. Thank you so much.
Get excited. It is time